We're going to talk about Lipodissolve, which is a fat reduction procedure done with a medication that permanently destroys fat cells. And I'm going to tell you just about a brief history. We'll show you some before and after photos, a single treatment, even though it can be done more than one time. And one of my favorite places to treat it is the subcutaneous fat of the neck, but it can be used anywhere there's fat pockets at. So Lipodissolve is a term given to a medication that is made up of a combination of medications called phosphatidylcholine deoxycholate. And the origins are from the 90s. There was a Dr. Ritz, R-I-T-T-E-S, Patricia Ritz from Brazil, who used this same drug to treat the little fat pads underneath the eye. She published it in a journal. And this led it to kind of eventually get to the United States in 2004, where we termed it Lipodissolve. There's only a handful of doctors doing it at that time. At one time, we called it mesotherapy, which was a French term talking about the mesoderm, but the Lipodissolve is one that kind of stuck. The medication is used in Europe, and it's called Lipostable. That's a brand name by a manufacturer drug for intravenous use to break up plaques, soft plaques in the cardiovascular system. And because of this, Dr. Ritz postulated that perhaps it could break up fats injected directly into adipose tissue. So in about 2004, there was the first Lipodissolve societies identified in America. There's a handful of doctors doing this. Some people again call it mesotherapy. Some people call it Lipodissolve. And I was a member of that right from the onset. One of the first doctors, one of the first 8 doctors doing this in the United States. We again brought it in from South America. And at first, we didn't know how much medicine to use, which of these components of phosphatidylcholine or deoxycholate is causing the action of destroying the fat cells. It wasn't crystal clear. And there was a Dr. Patrick Rotunda. He was a dermatology resident, I think, at UCLA. And he was trying to figure out which component, the phosphatidylcholine or deoxycholate, was actually destroying the fat. So he started experimenting with pig fat, tissue that had been removed from a pig, and injecting both phosphatidylcholine alone and deoxycholate alone, even a combination, to see it worked. It turns out it was the deoxycholate that was the active ingredient of this phosphatidylcholine deoxycholate, what I'll call PCDC. So long story is that made short is that he eventually figured out that you couldn't treat big areas with this because it was too inflammatory. And they came up with a system where you put little drops, micro droplets just underneath the skin in a grid-like fashion. So they make a little template to have little dots on it. You put a little micro drop in each spot and put it underneath the skin of the neck and do it multiple times with low dose, and people will be able to tolerate the inflammation. And that became called Kybella, which is an Allergan product called Kybella. Well, it never really took off. Again, Allergan paid a lot of money for this Kybella technology or licensure patent, and it wound up delivering as promised. So why not? What happened? Well, it's been shown that if you take the deoxycholate alone or the PCDC, the phosphatidylcholine plus deoxycholate, with the same amount of material, same amount of milligrams of deoxycholate, you get a similar ultimate outcome. The difference is, and it's a massive difference, is that the PC of the PCDC calms down the inflammation of the DC by itself. So the DC by itself does destroy fat cells, but it's so wildly inflammatory, creates nodules, a lot of redness, burning, and discomfort and pain that we couldn't really treat big areas or do more than a microdosing. But if we added the PC to it, you could use a lot more of the DC, a lot more drug, get a much better result, way less treatments, way less inflammation, way less downtime. So we just come back in full circle. So we were using this since 2004, PCDC. And something that we were very successful with for over a decade before the Kybella came out. When Kybella came out, we tried it. It's like, wow, this stuff doesn't work so good. You can't use nearly as much drug, use about 1/10 as much DC, getting a lot of inflammation, a lot of pain. And people would need to do about 6 or 7 treatments to see what we're getting in maybe 1 or 2 of the PCDC. So we did abandon the use of Kybella. And I know people still use it, but the original stuff, the PCDC, is still available. It's made by a FDA-approved 503B manufacturer type of a compound. It is designed to be used both intravenous for breaking up soft plaques, but also can be used subcutaneous for killing off fat cells. So how is it working? Well, the deoxycholate portion of the PCDC is a bile salt, and it directly emulsifies the fat wall. So the fat cell gets destroyed, the lipids leak out, and the cells go through what's called apoptosis or apoptosis, where the cell dies and it doesn't get replaced by another cell. So in many cases, your cells will die, programmed, and another pre-adipocyte or stem cell will replace it. In the case of destroying the fat cells, they don't get replaced. So the fat reduction is permanent. Now, you could always grow more fat tissue by expanding other fat cells. But in general, if your weight stays about the same, the reduction in fat will be permanent. It doesn't grow back. So they've experimented on animals where they inject it right into other tissues like the skin or the muscle, and it still just destroys fat. It doesn't destroy skin or muscle. Now, we can see damage to the skin in the case of pressure dressings. Many cases, people are putting on compression because it feels better, but this can cause pressure sores. But in and of itself, it is very tolerant to the tissues and is selectively treating fat cells. The reduction in fat, some people are concerned that they'll have saggy skin. We're not really seeing that. First off, there's a lot of inflammation that may cause some tightening, but typically when your weight fluctuates, if it's not a massive amount, the skin tracks the muscle in the fat. The skin tracks the size of the muscle in the fat. So we're not seeing saggy skin afterwards. We have tried it for cellulite, not working so good for that. We have used it for the abdomen, the flanks, many different body parts. It can be used where there's subcutaneous fat. And the sweet spot seems to be the submental region of the neck. That's an area that, because it's not very big, we can get a really good target with the amount of medication we use. There is a limit to how much you can use. So somebody may say, I want to do my whole body. Well, you can only do about 120 cc's of this medication at the strength we use it, which is about 12.5 milligrams of deoxycholate DC and 25 milligrams of phosphatidylcholine per ml. We can use about 120 cc's, which is enough to treat an area about this big. So like an abdomen or something like that. We do the neck, we might use more like 10 or 15 cc's. The patient gets very red and swollen afterwards. It can look like an infection or a bee sting. In terms of the discomfort, sore, achy afterwards. And sometimes there's a little bit of firmness that lasts in the neck for a week or two, although you see the results pretty quickly, maybe in a week or so. And the final results are probably seen in about 2 months. So after the fat cells die, there's some cleaning up of the debris by your body, by your cleansing system, where, fat just gets reabsorbed, the tissues get reabsorbed, and the skin retracts and the tissues regenerate. So we're seeing pretty consistent results. We've been doing this for 20 years at Allure. I was one of the first doctors doing this. And so we've had 2 decades of experience with it. The Kybella came out kind of promising to be a brand name drug, having one less component, technically probably a flop for Allergan to have done that. And this kind of led people to forget about the PCDC, which the Kybella was based on. So Kybella was an opportunity for a manufacturer to take advantage of a generic drug, change it a little bit to get a new patent on it, and come up with something in this case that was inferior. So the original version of Lipodissolve is phosphatidylcholine deoxycholate. There's a certain strength that we use, and we find that having twice as many milligrams of phosphatidylcholine, or 2 to 4 times as much phosphatidylcholine as there is of the deoxycholate, there's much less inflammation, much less irritation, much less discomfort. You can use a higher dose of the deoxycholate, which is the active ingredient at a given time, than the deoxycholate alone, which really is a limitation to how much you can use because of inflammation and side effects. And this has been studied over the last 20 years. We have thorough information on it. When the Kybella came out, research on the PCDC kind of trickled off a little bit because now you got a major drug manufacturer supporting a new version. And that led to lack of interest. But then as the Kybella kind of didn't really turn out as promised, a lot of renewed interest in the phosphatidylcholine deoxycholate. The original version came out. And now in the days of, weight loss with the Wegovy and Ozempic and Mounjaro and Zepbound, these GLP-1 agonists, we're seeing people, they're losing weight, but they still have troubling areas that they just can't get rid of. And maybe they don't want surgery. They don't want liposuction. So the Lipodissolve or PCDC Lipodissolve is a good alternative for them. And again, you can only treat an area about this big around at a given time. So you might do your abdomen 1 week and do your flanks the next week, and then, wait a month or two to see the results, see if you need to just do it a second round. Typically, when we're doing the neck, we're doing it one time and getting a good result. Some people do need more. If you did Kybella, it's average about 6 times. So we're not recommending Kybella. It's too expensive. The drug is way more expensive, way less effective. And the results are seen in 2 months for the final results, but you get a kind of have some downtime of redness and swelling for 2-3 days, maybe 4 or 5 days in some cases. So areas like in your waist, you can hide it pretty good, but you might not go to the gym because it's going to hurt and jostling around. Your neck, really can't hide it. You put a mask on or something, it's kind of hard to hide it. So people might do this on a Friday and lay low Saturday and Sunday. And then on Monday, it's kind of hard to see you had anything done. And it's an alternative to liposuction. You use it in areas that you would perform liposuction. So subcutaneous fat, and liposuction is something that we do, that we offer, but there's a lot of people, probably more people want to lose fat and not have liposuction than people want to lose fat and have liposuction. It is probably more cost effective to do PCDC in the neck than liposuction in the neck. But liposuction maybe gives us more, tailored approach, but the results we're seeing with PCDC are pretty consistent. The images that you'll see are before and afters of just one treatment. Usually we're taking a picture afterwards, like 2 to 5 months after, because that's when all the tissues the final results do occur. So Lipodissolve is still an option. There's other options for non-surgical fat loss besides weight loss, which would include freezing, cool sculpting. We've done cool sculpting for 12, 13 years. And, cool sculpting has worked pretty well. Never worked better than a Lipodissolve, but cool sculpting has no post-procedure discomfort. It's more expensive, not quite as effective, but more post-procedure discomfort. There's ways to use heat. There's some laser devices and radio frequency devices on the market, M-Sculpt and TrueSculpt and others that are effective. We've had different of those technologies as well. And the 3 go-tos we have would be PCDC, Lipodissolve, M-Sculpt or M-Sculpt Neo, and cool sculpting. But we have the most experience with the PCDC, and it's kind of based on what we're trying to achieve. So the cool sculpting is for the person that doesn't want any shots and doesn't want the post-procedure pain and understands it's more expensive, not quite as effective. The M-Sculpting is more for that person that wants to do some muscle building simultaneous with fat loss, which we don't see with cool sculpting or Lipodissolve. And a Lipodissolve is for the person who purely wants to have fat reduction in a targeted area. We get a much more targeted approach with Lipodissolve than any of the other technologies. So thank you very much.